Myth number 13, no boobs equals no breast cancer. Oh, I really believe that there is a huge misconception around this topic, that no boobs equals no chance of breast cancer. I get countless messages from women here on the channel and on social media reiterating this false notion that they just want their breasts gone. Get them off, so I'll never have breast cancer again. It unfortunately isn't always that easy. Some women, even after mastectomies, can still get breast cancer. I remember my oncologist explaining to me that as a tumor grows in the breast over time, it's not impossible that a cancer cell can get loose and enter the lymphatic system or even the bloodstream and therefore show up in other parts of the body. In other words, the horse might already be out of the barn before you surgically remove the breast tissue. This can be how metastatic breast cancer begins and how it can take residence in other areas of the body, like the lungs or the brain. I've been told by my doctors, many of whom are featured here on Alive, that often the goal these days for breast cancer patients is breast conservation. For instance, for someone like me who was diagnosed with stage 2 triple negative in one breast, we decided to take a neoadjuvant approach to my treatment, which means that we did all of my chemotherapy before the surgery so that we could shrink those tumors as much as possible. This way, when it was time for the lumpectomy, I was able to have a much smaller surgery because the tumors actually shrunk. Survival rates are about the same for women who have mastectomies and for those women like me who choose the breast-conserving option like a lumpectomy with follow-up radiation therapy. However, when we're talking about women or men with the genetic mutation of BRCA1 or BRCA2, or for patients who have advanced DCIS disease, lumpectomy and radiation might not be the appropriate course of action. So again, it's so important to talk to your doctor. Every breast cancer is different, and you need to know about every option. Mastectomies, though, are a very big procedure and really aren't needed for everyone. You might want to explore some of the other choices that might be available to you before moving forward.